Let's go to our next presentation. Niamh McElhatton is CEO and co-founder of Stimuli. Stimuli is a SaaS-based platform that acts as a strategic clinical design tool, enabling hospitals to make better capacity planning decisions in order to reduce hospital waiting lists. It's a spin-out from UCC. Niamh, with the support of our co-founder, well known in the world of artificial intelligence, Professor Barry O'Sullivan, are in the middle of raising their seed fund in order to commercialise the solution. Your 3 minutes start now.
Imagine you or a loved one lost your life whilst on a waiting list for a simple procedure. In Northern Ireland, over 22,000 people have lost their life while on NI Health Service waiting lists in the last 5 years. There's now over 7 million people in Ireland and in the UK on some form of hospital waiting list. The Irish government recently announced that they were allocating €250 million to solely tackle the hospital waiting list problem. And the UK government have announced that they're allocating £5.9 billion to create 100 diagnostic hubs throughout the UK to tackle the backlog. Stimuli is a spin-out from the University College in Cork, co-founded by myself and the prolific Professor Barry O'Sullivan. We're a SaaS platform that acts as a strategic clinical design tool that enables hospitals to make better capacity planning decisions. Through the use of machine learning, the software processes and analyses a clinic's historical data to predict future demands. We provide evidence-based data intelligence that allows the hospitals to make the right strategic decisions when it comes to planning delivery performance. We're fully GDPR compliant as we only use anonymised data. There's no risk to utilising Stimuli as we will never worsen a hospital waiting list. We adhere to all hospital compliance and governance protocol. The beauty of our solution is that we save clinicians and their teams an abundance of time. What typically would take months of planning is now processed at a superhuman rate, giving the teams that much needed time to focus on the delivery of care for patients. Ideally, we want to start our journey in diagnostics, as typically this is where the patient journey begins too. But it's worth noting that we're not restricted to any speciality or discipline. Currently, we have 4 live pilots running in the UK and Ireland, and we're making great traction in the Canadian market. And our pilot results will be available in early Q1 in 2022. In one previous project with an MRI department, we were able to reduce the department's waiting time from 281 days to 24 days by simply understanding the historical data and the inefficiencies in clinical design. Our addressable market expenditure is more than 100 billion. And whilst we already have a working desktop application, we're looking to raise 600,000 to commercialise the product on Azure and to accelerate on a global market. We know our solution works, and folks, life is so very, very precious. We're very excited for you to be part of our journey. Thank you.
Niamh, thank you very much for that. Can I just ask you, just for the Irish market first, the HSE and our hospitals have been criticised perhaps for having old-fashioned technology, unsecure technology, some of them working on Windows 7. Is your technology going to be too advanced for many of them to be able to cope with?
Well, to be honest, Matt, our technology is adaptable depending on what the software is. We're a standalone solution at the moment, so if we need to be interoperable, we can. Ideally, we'll plug in on HL7 to make it more secure and data protection and all of that. But we're standalone at the moment, so it depends. It'll totally vary on the hospital. It'll vary on what the governance and compliance is for every hospital. Believe it or not, they all differ.
Not your fault, but many of these hospitals seem to be very much paper-based and haven't digitised a lot of their records. So is that going to in some way perhaps restrict the potential here in Ireland, if not overseas?
No, I think with the data that we capture, every hospital needs to have this certain information. It just depends where it's stored at the minute. And believe it or not, I have seen in the past when we've asked on how they manage their waiting times at the minute, they've held up an A4 leather-bound diary. So it is an issue that needs to be addressed.
It's very much an issue that needs to be addressed. But again, tell us a little bit about the GDPR issues and how you're going to get around those, because confidentiality has been a major issue as well in our health system.
Huge. And as I said earlier, it's all anonymised. So we don't want to know your name, anything about you. We want to know the patient type, how long your appointment needs to be, and then we can subcategorise based on patient type, whether it's urgent, inpatient, outpatient, referral, etc.
Are you going to have to manage it though on behalf of the hospitals, the SaaS platform? Because there is a problem with many big organisations. They get the data in, they don't know how to use it.
Well, I think that's fundamental, yeah. But we will work with the team to extrapolate the data that we need. Every speciality will have a different set.
Niamh, thank you very much for
Thanks
being
very
with
much.
us.